Welcome to the STAGO Compact Analyzer monthly maintenance installment of syringe tip and O-ring in-service session. At the completion of this in-service session, technologists will be able to perform the replacement of the syringe tip and O-ring on the STAGO instrument at the time of monthly maintenance using the instrument and laboratory procedure manuals. Upon completion of this training session, technologists will be able to perform monthly maintenance on the STAGO instrument analysis with minimal to no supervision 90% of the time. Materials needed for this session: PPE, O-ring, syringe Teflon tip, tweezers or clamps, DI water, gauze, coagulation policies and procedure manual, STA Compact Max Customer Training Manual. Step 1. You will locate the STA Compact Max Customer Training Manual. Under Monthly Maintenance, you will find the replacement of the syringe tip and O-ring. Next, you will locate the Coagulation Policy and Procedure. In that, you will find COAG 32 STA Compact Max Maintenance. In that procedure, you will locate monthly maintenance, and that is where you will follow the instructions to get you set up for the syringe tip and O-ring replacement. Step 2 is the removal and replacement of the syringe tip. You start by opening the right side of the instrument and loosening the bottom screw, and then you can remove the syringe from the glassware. You then want to take a piece of gauze and very carefully remove the glassware and release from the metal fitting. Be careful not to break the glassware in doing this process. You also want to pat it dry so it can be reused. Next is the replacement of the Teflon tip. It can be difficult to get off, so using a blunt instrument or a clamp will make things a little easier. So next you want to grab your new Teflon tip, and there's a device that is used. It's black, and in the middle of it is a little hole where you can place the Teflon tip with the hole facing upward. This is used because the tip is sometimes difficult to get on from just using your fingers. So with placing that on a clean flat surface with the hole facing up, insert the piston barb into the hole in the new tip and press downward to fully seat the new tip. This does take some force to get it on flush with the syringe. And as you can see, it's on nice and flush. Step 3 is removal and replacement of the O-ring. This is done taking a fine tweezer and removing the O-ring from the metal fitting. This does take a little bit of finesse to get that out. Once it's out, it can be discarded into the biohazard bin. Now the replacement of the O-ring, you want to make sure it is wet. That helps with preventing leakage problems and erroneous results of your PT results. Once on, screw the metal fitting into the top and make sure it is finger tight. Not too tight, not too loose, just finger tight. And now the syringe is also ready to be installed. You then place it on the bottom screw. Also make sure that it's finger tight, and be very careful when inserting the syringe into the glassware. You do not want to break the glassware because that is hard to replace and expensive. When replacing the syringe, you should put it in about halfway. Here are some common errors when replacement of the syringe tip and O-ring have been completed. The O-ring has not been on properly, the syringe tip is not on properly, not flush on the syringe, metal fitting is not tightened enough or too tight. So when priming, sometimes this can happen. The syringe leaks water, and at this time you will need to stop or perform an emergency stop and reassess what could be happening. If you do discover leakage, uninstall the syringe and check the O-ring and tip. Make sure everything is flush. Sometimes wetting the tip may help with the process of reinstalling the glassware. Also make sure all the screws and the metal fitting is finger tight. After troubleshooting, the reinstallment of the syringe should look something like this. There should be no leakage when priming, and also no leakage after the priming is stopped. You want to assess this by running your fingers around the metal fitting to make sure no water is on your gloves by visual inspection. After this is completed, you will then mark on the maintenance form and confirm on the instrument that maintenance has been completed. Final steps: initial date and time, completion of monthly maintenance on maintenance form, run QC and verify PT results are within normal limits. Thank you.